Welcome to today's event on skilled nursing facility coverage criteria. Again, my name is Mary Sue Gardner, and I am going to be your presenter for today's call. A few things that I wanted to show you before we get started. First, our disclaimer. Our disclaimer basically reads that the information that we're giving you today is true and according to Medicare regulations as of today. If those regulations change tomorrow, it is your place as a provider to follow the most current Medicare rules and regulations and make sure you're following the most up-to-date regulations. Also, CMS prohibits recording of this presentation for profit-making purposes. We are, however, recording it for you, and it will be on our encore page, but you just cannot record it for profit-making purposes. All right, these are a few acronyms that I will use within this presentation. So if I say an acronym and you don't know what it is, you can refer right back to this acronyms list. Our overall objectives and agenda for today. The objective I want you guys to meet today is to understand what Medicare requires for extended care services or SNF coverage. And I hope to achieve that today by going through those requirements and what CMS has defined as considering skilled care, and those coverage requirements and the benefit periods that are listed. So as we move on, and if you're following along with the slide deck, we're on the slide that starts with defining SNF inpatient care. Medicare Part A covers Medicare certified skilled nursing facility care for post-hospital extended care services that are furnished to an inpatient of a skilled nursing facility as a covered Medicare benefit under Medicare Part A benefits. It requires the skills of a qualified technical or professional health professional. That means that skilled care is nursing or other rehabilitative care that's provided according to a physician order, and that requires the skills of that qualified technical or professional health professional, such as a registered nurse or a licensed vocational or a licensed practical nurse, physical therapist, occupational therapist, speech language pathologist, and even audiologists. Additionally, those items and services must be provided either directly or under arrangements. So remember, some skilled services are provided directly by or under the general skilled nursing or skilled rehabilitation personnel supervision and this is done to ensure that the patient's safety and medical needs are met. So when we define general supervision, it is supervision requiring initial direction and periodic inspection of the actual activity. The supervisor of that isn't always physically present or at the location when an assistant performs the services. Also, the services must be provided in a SNF Part A stay according to a physician order. And the SNF services can be rendered in a facility that's freestanding or in a swing bed, which is part of a hospital or critical access hospital. And really, all the information that I'm providing you today regarding the SNF coverage criteria can be found in the Medicare Benefit Policy Manual. And Rachel is going to put that manual, if she hasn't already, into our chat. And it doesn't mean you need to go out to it now, but the Benefit Policy Manual, Chapter 8, is all things about coverage of extended care SNF services under the patient's hospital insurance. So let's move on and discuss some general requirements. When we define the term extended care services, this means the following items and services have been ordered by the physician and are furnished to an inpatient of the SNF either directly or under arrangements. So that includes your nursing care that's provided by or under the supervision of the registered professional nurse, the bed and board in connection with the furnishing of such nursing care, PT, OT, SLP services that are furnished by the skilled nursing facility or by others under arrangements that have been made by the facility, medical social services and drugs, biologicals, supplies, appliance, equipment, those things furnished for use in the skilled nursing facility that are ordinarily furnished by such facility for the care and treatment of their inpatients. And it also includes other services that are necessary for the health care of the patient that are also generally provided by the skilled nursing facility or by others under arrangements. So remember, SNF services are basically an extension of care for a condition for which the individual received inpatient hospital services. As we move on, and we'll talk about to qualify for skilled nursing facility stays and payment under the Part A benefit, all of the following conditions must be met. So I'm going to review these quickly, and then we're going to discuss them more in depth. So services must be provided for the treatment of a condition for which the beneficiary was receiving the inpatient hospital services, or a condition which arose while in the SNF for the treatment of a condition which they were previously hospitalized. I know that's a mouthful, but we'll go back and discuss it a little bit more. The patient also has to have a 3-day qualifying hospital stay. So that means the patient was a hospital inpatient for a medically necessary stay of at least 3 consecutive calendar days. It doesn't include the discharge day or any pre-admission time spent in emergency room or even outpatient observation. The patient has to transfer to the SNF post-hospital within 30 days. So there's a 30-day transfer rule, but there is an exception to the rule when it's medically inappropriate for that patient to start skilled services within that first 30 days. And we'll discuss that medically appropriate exception in a little bit. The patient also has to need daily skilled nursing or rehabilitative services. Now that requirement for daily nursing can be met or must be met by providing skilled nursing services 7 days a week. For therapy, that requirement can be met in 5 days a week. And the patient must have a physician's order for skilled nursing facility services, and those services must be medically reasonable and necessary. Finally, the patient has to have benefit days available to them. So let's break these down. For the same condition as hospitalization, what does this mean? This means that the services must be provided for the treatment of the condition for which the beneficiary was receiving those inpatient hospital services, or a condition which arose while in the SNF for the treatment of the condition for which the beneficiary was previously hospitalized. So for instance, let's say that the patient was hospitalized for a surgical procedure, and while in the skilled nursing facility, developed a wound infection that requires additional Part A care. That would be considered a condition which arose while in the SNF, which was a result from the hospital stay. The next requirement that we talked about was the inpatient stay of 3 days. So a beneficiary must have been an inpatient of a hospital for a medically necessary stay of at least 3 consecutive calendar days. And we said this before, but time spent in observation or in the emergency room prior to an inpatient admission or in lieu of that inpatient admission does not count towards the 3-day qualifying hospital stay. And that's because, you know, that a person or a patient that appears at the hospital emergency room seeking an examination or treatment, or that is placed in observation, has not been formally admitted as an inpatient. Instead, they're receiving outpatient services. So for the purpose of the SNF benefit, the qualifying hospital stay, that inpatient stay commences with the calendar day of the hospital admission. So the easiest way to think about this requirement, and if that patient met that requirement, is to think about the midnights. Was that patient in a bed for 3 midnights? And if the answer is yes to that, then they have met the 3-day qualifying stay. Again, besides the benefit policy manual, all of these requirements can also be found in the 42 Code of Federal Regulations 409.30. And Rachel's going to throw that in the chat for you as well. All right, the next requirement is a 30-day transfer. So the beneficiary must have transferred to the participating skilled nursing facility within 30 days after discharge from the hospital, unless there is a medically appropriate exception that applies. So what is the exception? That exception reads that an elapsed period of more than 30 days is permitted for SNF admissions where the patient's condition makes it medically inappropriate to begin an active course of treatment in the SNF immediately following the hospital discharge. And it is medically predictable at the time of the hospital discharge that they will require covered care within a predeterminable amount of time. So again, it must be medically predictable at the time of hospital discharge that they are going to require covered care in a predetermined amount of time. So for example, let's think about a patient who has an orthopedic condition of the lower extremities, and they cannot actively participate in skilled therapy due to a non-weight-bearing status for 40 days post-surgery. And they don't have any other, let's say at this time, they don't have any other qualifying factors that will make them skilled. In this case, they can transfer to the SNF after that 30-day mark because they had a predetermined time period where they could start receiving skilled services. Now remember, entering a SNF post-discharge for covered or non-covered condition does not necessarily negate coverage at a later date, assuming that the subsequent covered care was medically predictable. You know, for example, we used that non-weight-bearing status. There are also times that in this same example of this non-weight-bearing patient, they could enter the skilled nursing facility as a skilled patient and receive skilled therapy services, maybe to teach them how to maneuver the bed, maneuver the overhead trapeze, things that, that would be done by physical therapy, and then they could go off skilled services until that patient can actively participate in skilled care in that predetermined amount of time. So remember, there is a component of the regulations that allows for presumption of coverage. So what presumption of coverage means is that beneficiaries who are admitted or readmitted directly to the SNF after a qualifying hospital stay are considered to meet the level of care requirements up to and including the assessment reference date, or the ARD date, for that initial Medicare assessment period of time, just so long as they are appropriately assigned into one of those case mix classifications that CMS designates for this purpose. So again, neither is wrong, and the medically appropriate exception to the 30-day transfer can apply in one of two ways. The one thing I do want to note, though, if a patient is not directly admitted to the SNF after a qualifying hospital stay, that presumption of care that includes up to and including the first ARD date does not apply. So that's the only time that part applies. All right. As we move on, let's talk about the next component of coverage, which is daily skilled care need. We talked a little bit about this when we first spoke about these general requirements, and we can really equate daily skilled service need to medical necessity of services. So daily skilled care is defined as skilled nursing services or skilled rehab services, or a combination of both, that must be needed and provided on a daily basis. So essentially 7-day-a-week basis. For skilled nursing services to meet this daily requirement, those services need to be provided 7 days a week. A patient whose stay is solely based on skilled rehabilitative services would meet the daily requirement on at least 5 days a week. So if therapy services are provided less than 5 days a week, the daily requirement would not be met. We don't apply this so strictly that it would not allow for an isolated break of a day or two, which no skilled nursing rehab services are furnished. For example, if the patient were to contract the flu and was unable to participate for several days, it may mean that you have to recalculate their HIPS code for that time, but being an isolated incident wouldn't necessarily negate skilled services altogether. In instances that require a skilled restorative nursing program, so not rehabilitative skilled therapy services, but a skilled restorative program, to meet that expectation, the expectation is the program is rendered at least 6 days a week. Please note, though, that when the patient's skilled status is based on a restorative program, medical evidence must be documented to justify this service. In most instances, it is expected that a skilled restorative program will be at most only a few weeks in duration. So the daily basis requirement can be met by furnishing a single type of skilled services every day, or by furnishing various types of skilled services on different days of the week that collectively add up to meet that daily requirement. But you should know that if you are trying to play the game where you're doing maybe PT 3 times a week and OT 2 times a week just to look like it's satisfying that requirement, and there's no indication to say that PT and OT can't be provided on the same day, that would not be meeting the requirements of a daily basis. So really make sure your documentation is really saying why, if 2 services can't be provided on the same day, why that is the case, and why you would have to span them out to continue to meet the daily service requirement. Okay, as we move on, the next indication for coverage is the physician's order and certification. So we, as your MAC, use the physician order and certification to really support that the services being provided are under the care of a physician. So services must be ordered by a physician, and the services must be rendered for a condition for which the patient received inpatient hospital services or a condition that arose while in the SNF because of why they were receiving inpatient hospital services. You can see just by how many times I've repeated that, how important that is to justify that part in your documentation. So the physician orders must include the specific skilled services that the patient needs to receive, whether that's PT, OT, SLP, wound care, IV medications, parenteral enteral nutrition, etc. Payment for covered post-hospital extended care services may be made only if the physician or that physician extender makes the required certifications, and when services are furnished over a period of time, the required recertifications regarding their overall services. So the SNF is the one that's responsible to obtain and retain the required certification, recertification statements, and orders. We, as your MAC, the AB MAC, we may request that information to help us in determining the medical necessity of the patient's stay. So the SNF, you are responsible for how you want to obtain that required certification and any necessary recertification statements. We have no requirement for a specific procedure that must be followed or a specific form, as long as the approach that's adopted by your facility permits verification that the certification and recertification requirements are met. So certification and recertification statements can be entered into forms. They could be on physician progress notes or any other place in your record that would normally be signed by your physician that's caring for your patient. Except as otherwise specified, each certification and recertification is to be signed separately. So we're going to talk a little bit more about certifications and recertifications in a little bit, or we're going to continue this as well. If the SNF fails to obtain certification or recertification, and it's not due to a question of necessity of the service, but instead the physician or that a physician's extender, their refusal to certify on other grounds, like they object to the principle or concept of certifications and recertifications, you as the SNF cannot charge the beneficiary for the covered items or services. That's part of your SNF's provider agreement, and it precludes you from doing so. So again, if that physician just decides they don't want to certify on whatever grounds, but the services would be medically reasonable and necessary, you can't turn around and charge the Benny. If the physician or physician extender refuses to sign because in their opinion that patient doesn't require a daily skilled care for that treatment of what they were hospitalized for, and then the services would not be considered covered, and the facility could then bill the patient directly. So if the family says, oh yeah, we want mom to be admitted here, but the services really aren't medically reasonable and necessary, you can then turn around and bill the beneficiary for those services. As we move on, and if you're following along in the slide deck, we're on the slide that starts with certification and recertification timeframes. So certifications must be obtained at the time of admission or as soon thereafter as is reasonable and practicable. So that's CMS's wording on that. What does that mean? Your first certification needs to be done as soon as possible, but for or with your first recertification, which is your 14th day. So the 14th day, again, is the first recertification, and it must be made on or before the 14th day of that inpatient extended care service. A skilled nursing facility can, at its option, provide for the first recertification to be made earlier than the 14th day if they want. So you can vary your time, but it has to be on or before the 14th day. And then your subsequent recertifications must be made at intervals not exceeding 30 days. And that's 30 days from the last signature. So let's put this all in perspective. The first certification as soon as possible, but it can be made in conjunction with the first recertification, which has to occur on or before the 14th day that they're in the skilled nursing facility. And then all of your following recertifications are at intervals not exceeding 30 days from the last signature. Now, some SNF providers use a certification form that contains reminders on the left-hand side that the facility can fill in for the physician to remind the physician the date in which they need to sign. But if you go by this date that they signed this 14th day and it's on or before the it's before the 14th day, and you made those reminders for the admission day, the exact 14th day, and then the exact 30 day following that, and they signed before that, it could put you out of compliance with one of these later 30-day certification timeframes. So we really encourage you not to put the reminder date in until that physician signs, and then make your reminder 30 days after that signature date. There are some provisions for delayed certification that exist in the regulations. However, you must know that there are also steps that need to be followed to use that delayed certification provision. And this includes the physician has to include an explanation of the reason for delay and evidence that that patient was under their care. So make sure if you miss a date that your physician is giving those reasons for the delayed certification and making those statements that that patient was indeed still under their care. All right, just a few more specifics on the certification and recertification requirements. I've spoke about some of these already, but just want to make sure that we hit all the things that are included. Your certifications and recertifications need to contain the need for the skilled services that can only safely and effectively be provided in that SNF or swing bed on a daily basis. And they have to include that practitioner's dated signature. Now, if that signature isn't legible, you can have a printed signature that appears with that illegible signature, or you can provide a signature log to help ensure that this illegible signature does indeed go with this physician's name. Recertifications. Your recertification should also include that reason for continued SNF care, as well as expected length of stay and an explanation if continued need for services is for a condition that arose after the SNF admission. And then the last thing, if there's any plans for home care, that should be starting to be identified in your recertification statement. So it's not enough just to say continue PT. Your physician needs to say what they are continuing physical therapy services for and how long they expect that to continue to last. So there are eligible practitioners that can complete your certification and recertifications, and that includes your physicians and your physician extenders, such as your nurse practitioners, clinical nurse specialists, or a physician assistant. But these extenders cannot be directly employed by the SNF. They have to instead be working with or for the physician. So the regulations do not allow for these extenders to be the ones to do the recertifications if there is a direct employment relationship with the skilled nursing facility. And in that prior Medicare publication that Rachel posted for you, 102, Chapter 8, that actually is in Section 40, if you wanted to take note of that. All right, and finally, the patient needs to have covered skilled days remaining. So Medicare uses a period of time called a benefit period to keep track of how many days of skilled nursing facility benefits a beneficiary uses and how many are still available. A benefit period begins on the day that the beneficiary starts getting SNF care, so the admit date. And beneficiaries can get up to 100 days of skilled nursing facility coverage in a benefit period. Once those 100 days are used, the current benefit period must end before a new benefit period can be given to that beneficiary. There's no limit to the amount of benefit periods that a beneficiary can have. However, once the benefit period ends, there has to be another 3-day qualifying hospital stay and meet the Medicare requirements before another 100 days of SNF benefits will take place. Now, that's only if that patient has ended the benefit period and has been well or facility-free for 60 days. And we're going to talk about that again in a second. So a patient having hospital insurance coverage, or Part A, is entitled to have payment made on his or her behalf for up to 100 days of covered inpatient services in each benefit period. Now, that also doesn't mean they automatically get 100 days. They get up to 100 days so long as those days are medically reasonable and necessary and services are provided in accordance with the Medicare regulations. So a benefit period ends when the beneficiary, again, is facility-free or not in a Medicare certified bed or distinct part unit and not receiving skilled care for 60 consecutive days. And you begin counting with the day the individual was discharged. So again, that person has to either A, leave the facility for at least 60 consecutive days or leave a skilled nursing facility and be well, and I'm air quoting well, for 60 consecutive days, or maybe they remain in your facility as a nursing facility patient, but they're not in a certified bed or in a certified distinct part unit, and they're not receiving daily skilled services for 60 consecutive days. A new benefit period will then begin, or they'll be eligible for a new benefit period after a 60-day break from that last inpatient admission. But also note that a beneficiary can be discharged and readmitted to a SNF several times during a benefit period and still be within the same benefit period if 60 consecutive days have not elapsed. So the stay need not even before a related physical or mental condition. So let's say that the patient was in your skilled nursing facility receiving Part A services, and then something happened and they had to go to the hospital and they were readmitted to the hospital. So the SNF has then discharged them. And let's say they are in the hospital for 2 weeks and they come back, they could be readmitted into that same benefit period, or they would be eligible for readmission into that same benefit period. Remember, your benefit period has nothing to do with diagnoses. If a patient goes to a hospital and returns with a different diagnosis, it does not start a new benefit period for them. Also, a beneficiary can exhaust a benefit period and it doesn't close. So what I mean by that is that they have used up their 100 skilled days, but they continue to receive a daily skilled service. If a beneficiary continues to receive skilled services, the SNF must continue to report them as skilled. This beneficiary then will never close the benefit period so long as they continue to receive that daily skilled service, therefore not eligible for another benefit period, unless, again, they're discharged and leave the facility for at least 60 consecutive days, or they go to a non-skilled level, they remain in the facility, they're not in a Medicare certified bed or distinct unit and not receiving a daily skilled service. All right, so a little bit about benefit period days, and I'm not going to talk about billing per se. I just wanted to go over this briefly as to what type of Medicare payment is included with the benefit period. So SNF coverage is 100 benefit days per benefit period. 20 of those days are considered full days, so there's $0 coinsurance for those days. But days 21 through 100 are those 80 days are considered coinsurance day. And the current rate on that is $200 per day of coinsurance. So the date of admission is counted, and that day begins at the midnight census and ends 24 hours later, so midnight to midnight. A part of a day counts as a full day when it is like the day of admission and they come at 4 in the afternoon. or a day that a beneficiary returns from a leave of absence. So those would be partial days and would still be considered as full days. So think of them as your day of admission day. Day of discharge is not counted. So the day of discharge or death, or the day on which a beneficiary begins a leave of absence and they're not going to be in that bed at the midnight census, is not counted as a day. The only exception is unless discharge and death occur on the day, discharge or death, I'm sorry, occur on the day of admission. So remember, the beneficiary must be in a facility at the midnight census for that benefit period, or for that day to count. All right. So let's wrap up what we've discussed. We went over the reviewed requirements for extended care services. So I hope by listening today that you have a better understanding of what is considered skilled for skilled care services. And we also went over those SNF coverage criteria and benefit period information. Before I ask Rachel, sorry if we have any questions that have come into the chat, I just wanted to bring this slide up for everyone. I'm asking everyone to please take a few minutes to complete our survey. Tell us what you liked about this event. And our survey also gives you the opportunity to suggest future education. So your feedback is really invaluable to ensuring the education that we offer is timely and effective and what you need. Skilled nursing facility, this is going to be a series that's ongoing. So every month, probably, I'm going to be bringing you information on skilled nursing facility services and about some of those issues that are resulting in the 5-claim probe and educate reviews that are happening. So it will be ongoing, but your opinion matters, and we do want your help. So please take time to take the survey. Tell us what else you would like. Next, if you have the slide deck, you can click on this link here to go take the survey. And if you have a smart device, you can just scan it with your smart device, be it a phone or a tablet, and the QR code will take you to the survey. So at this time, before we move on, I am going to pause and ask Rachel if we had any questions that have come into the queue that either have not been answered or that we can answer for the whole group.
Yep, so we have only one question about a link regarding CERT information, and I wanted to just pose that to you. I maybe missed some CERT info, but was there any CERT information that we had a link we wanted to provide in the chat?
No, actually, Rachel, I think you provided it earlier. All that information for the certification can be found in the Medicare Benefit Policy Manual in Chapter 8. And I am going to, give me just a second, and I will show everyone. All right, the Benefit Policy Manual, it should be on your screen right now. And the certification and recertification information is in Section 40. But the other place that you can find certification and recertification is in 100-01. And that is Chapter 4, Physician Certification and Recertification. And there is a section in here, ironically, that is Section 40 as well, Certification and Recertification by Physicians for Extended Care Services. So you can go either one of those places and find that information.
Okay, great. Thank you. Yeah, I read that as CERT as in the CERT contractor and was off base about what they were asking. So thank you for pulling that up. And otherwise, we do not have any questions that have come through in the chat so far.
And finally, if you have follow-up questions and you think of them after we close, you can put those follow-up questions in an email and send it to wps.gha.education@wpsic.com. I do see we have a question that came in. So if a skilled resident has a leave of absence to the hospital and returns with a different diagnosis, 2 diagnoses are okay to submit on the claim. So in the case that, in Angela's question, if you have a patient that was in an active period of time and they left your facility, and I'm assuming you say a leave of absence, but if a patient is admitted to an inpatient hospital and then comes back, that's really a forced discharge from your skilled nursing facility. So it wouldn't be a leave of absence in that case. It would be a discharge and readmit, and they would probably readmit, you know, under the same benefit period that you already had open. And it is okay to include that additional diagnoses on their claim as well. Now, if a patient has a true leave of absence, and let's say they go to a hospital and they are there in an observation status and not back at the midnight census because they're in an observation status, then you are not being forced to discharge that patient. And then that patient can again come back to your facility, resume that coverage. And if they have additional diagnoses, yes, you would want to report that on your claim as well, that they have an additional diagnosis, you know, that was obtained from that hospital observation stay. So kind of, I know I answered that in 2 different ways, but it really depends on how they went to the hospital and what happened once they got there. If it was an admit to acute care, they can't be acute care at your facility and acute care at a hospital at the same time. So that hospital acute stay would force you to discharge them. But they can come back in the same benefit period and resume their coverage and have an additional diagnosis. And either way, they can have an additional diagnosis added. I hope that answers your question. Are there some questions that we need to give answers to the entire group that would be helpful to the entire group?
The second one that I did respond to on regarding the certification and recertifications, can this be done electronically? I believe you did answer this, but yes, there is no requirements for a specific procedure or form as long as that meets all of the certification and recertification requirements by Medicare. I don't know if there's anything you wanted to add on to that question.
No, good question though. We do, we do accept electronic certification and recertifications. And again, Medicare doesn't have a specific form or specific means in which they need to be obtained, but you do need to follow the requirements. So they do need to be done in the time frames that Medicare specifies. They do need to contain that physician certification signature. Your recertifications do need to contain why the physician feels the need for continued services, be that physical, occupational, or speech language, or nursing services, wound care, etc., why that continues to be medically necessary. And again, make sure you're watching your dates when it comes to certifications and recertifications.
Yes. So we did get a couple other questions that just came in. So the first one that I'll read off is from Patricia. And the question is, did you say that a patient needs to be inpatient for at least 3 days before a new benefit period starts?
So yes, depending on how the patient's old benefit period. So let's say that you have a patient and they were a inpatient of your facility receiving skilled nursing facility services. And after they went off of Part A skilled nursing facility services, they remained in your facility as their resident. So they lived in your facility as a nursing home patient. That person needs to be out of a Medicare certified bed and not receiving skilled care, and what is considered well, not receiving skilled care for at least 60 consecutive days after that. And then in order to have a new benefit period, there has to be a qualifying hospital stay, just like they had before. And then they need to come back to your skilled nursing facility for whatever the condition was of the hospital inpatient stay or that arose as a result from that inpatient stay.
All right, thank you. So our next question is from Avery. The question is, can a nurse practitioner under employment with a SNF complete the initial certification?
And that is actually part of the conditions of coverage, Avery, and that no, a nurse practitioner cannot be directly or indirectly employed by the SNF. They must be working independently for that physician to be eligible to certify or recertify your patient.
Okay, and then our last question we have is, how would we report I think this exception applies on a skilled claim if it is more than 30 days after the QHS.
Since it has to do with the bill, I am going to reach out to one of my counterparts. If they know, maybe Aline or Tom, if there is a place on the bill where they would notate that or on the claim.
Hi, this is Aline. And in those medically predictable situations, your qualifying hospital stay will be on your claim. On the inpatient skilled nursing facility bill, there is a remarks section also that can be used to clarify that situation and what the patient's condition is that necessitates that delay in starting the skilled care. I hope that helps. Also, 100-4, Chapter 6 has information on that if you want to read more about that.
Perfect. Thank you, Aline. And I don't see any other questions have come into the chat. So we have about 5 minutes before the call end time, and I am going to leave this slide up. So if you have a smart device, you can scan it and you have time to take the survey during the time that you had allotted to be within this event. So again, additional questions, be sure to send those to this email address and we'll get those answers out to you. So on behalf of myself and Rachel and all of Provider Outreach and Education and our Medical Review Department, we want to thank you for your participation. We look forward to your participation on our future skilled nursing facility events. And that ends our event today, and you may now disconnect.